I would like to welcome you to the Social Workers Confronting Racial Injustice Conference. I'm Jenny Browngan, and I'm happy to have you here today for our breakout session called Practicing Connected in Community. To share a brief visual description of me, I'm an older white woman with shoulder-length red hair, wearing glasses and a dark green top and gray jacket today. I'd once again like to start with our university's land acknowledgement. The University of Wisconsin-Madison and the Sandra Rosenbaum School of Social Work occupy ancestral Ho-Chunk land, a place their nation has called Tejo since time immemorial. In an 1832 treaty, the Ho-Chunk were forced to cede this territory. Decades of ethnic cleansing followed when both the federal and state government repeatedly but unsuccessfully sought to forcibly remove the Ho-Chunk from Wisconsin. The history of colonization informs our shared future of collaboration and innovation. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. Next, I'd like to have just a few housekeeping notes for people to be aware of. That this presentation is being recorded and will be available on our conference website at a later date. To access this presentation, you are required to put your name and email in. This allows us to log our attendees and to email you the information on CEUs for this presentation. It'll be distributed to you via email at a later date. Your cameras and microphones will remain muted. But we do have a Q&A feature where you can submit questions for our presenters. Please know that due to the large number of attendees, we may not be able to get to all questions submitted. It is now my pleasure to introduce to you our presenters, Charla Yearwood and Myranda Warden. In this insightful breakout session, led by Charla Yearwood and her colleague Myranda, we will learn about Connected in Community, a pioneering group therapy practice established in 2020 with a resolute focus on equity and the development of anti-oppressive clinical practices. Charla and Myranda will candidly share the journey of navigating what has worked and what hasn't, and the pursuit of fostering an inclusive therapeutic space, discovering the innovative strategies implemented to dismantle barriers and foster a culture of inclusivity. Please join me in welcoming Charla and Myranda.
Thank you. Thank you very much. I'm going to go ahead and share the PowerPoint. It's going to go on with our discussion today. Okay, Myranda, you ready? Okay. So as I was introduced, I'm Charla, use she, her pronouns, and today Myranda and I together are going to talk about our practice here in Indianapolis, Connected in Community, how we navigate it and what that looks like. Getting started here, I have a video where you can just see a little look inside of what our office looks like. Connected in Community, I started it in 2020 after events were going on with George Floyd and Black Lives Matter protests. At the time, just because of my role in Indianapolis and the larger community, I was asked if I would be willing and open to open space to hold space for people wanting to process racial injustice and current events. And so in that quest and along with those requests to do that, I created a part-time practice for myself while I was working full-time, where I helped people process those events as they were occurring. To be honest, that kind of blew up. And we got a lot of people interested in wanting to work through therapy from that lens and that perspective. And so that eventually grew into a full-time job for me. And then Myranda is the first person who I asked to come join me in this project, as we have had community outside of this practice that let me know that Myranda and I have a similar approach to the way that we see therapy and how we try to do this work. And so together we have been trying to figure out a little bit more clearly what this work looks like and what kind of the steps of this work are, or just really piecing it together and understanding it. We do that work together in community, and we also have this practice. So I'm gonna go a little bit more detail and tell you a little bit more about Connected in Community and what this actually looks like as a business. Our business is intentionally inclusive. So when you walk in the doors, one of the first things you see is a beautiful picture of lovely Marsha P. Johnson on the wall. The art shows and showcases Black folks, other people of color. It showcases queer love. These are the things that just simply surround you when you walk into the office. You can see these things on our website. It's in our social media. Everything about the way that we're kind of branded and marketed tell the story of inclusivity and that everyone is welcome. And we're really just not centering cishet white folks. And oddly enough, that is somehow like different from the norm. So that just goes to show you just how often the norm really is cishet white. So since we already have marketing that is telling a story of inclusivity and that we are inviting people who aren't always considered or seeing themselves represented, we are inviting them into the space from the beginning, and we offer both mental health services and massage services. I can talk, we'll see if that comes up a little bit more throughout our conversation to talk about how we bridge those two together and what that looks like. But we're really trying to destigma mental health and take it out of this like strict medical model situation and really bring it into community and create a more holistic version of what healing looks like. And so then the last point I just wanted to point out here is that we are constantly actively engaging our imagination and figuring out what this looks like. So one of the things you might notice from our conversation today from both Rand and I is that we're not going to tell you, here are the steps to having an anti-oppressive practice. This is what you need to do so that your practice looks inclusive. We are not going to give you a 1, 2, 3, 4, 5, like step-by-step rule book. And we actually kind of confront the idea of that as a way to do therapy because people aren't step-by-step situations. And so we are constantly trying to figure out and explore and study and try and experiment with our practice and what that looks like. And so I think what you will find is that our call will be a lot more of a call to explore and get creative and imagine something different, more so than us telling you exactly what that in piece is going to look like. Miranda, am I missing anything there? Okay, I'm gonna hand it over to you.
Hey everyone, so grateful to be here. I really appreciated the visual explanation. So I'm gonna do that too. I've never done it before, but as Charla said, part of anti-oppressive practice is to self-reflect and to be like, hey, wow, that's something I've never done before. I'm gonna try it out and experiment anyway. So I'm Ran. I also go by Myranda. I use all gender pronouns. You really can't misgender me under what we know as gender right now anyway. I'm a white person. I am non-binary, but I mostly look like a dude these days, I'm told. I have white hair on my head and my facial hair is black. Anyway, that's a different story. Autoimmune disorders abound. So I'm going to talk about what it looks like for me to be doing anti-oppressive practice and with a connected community. So I'm really grateful to be part of this practice. I want to echo everything Charla said. She's not just the CEO telling you, this is, the aspiration of the thing. That is truly the embodiment. Like we're embodying the things that she was talking about previously. So I just want to co-sign that so hard. And want to name my sincere appreciation to be in practice and in community in such a way. So what does that look like for me? So what is the work that I do? I am a therapist. I do therapy at Connecting Community. I do peer support and I do education. It is not what I do full-time at this point. I'm actually a full-time lecturer for the Indiana University School of Social Work. And then I continue to practice as a clinician on a part-time basis. And what that looks like for me and clientele-wise is I'm really here for the liberation of all of us. I do believe our liberation is bound together. And I saw Angela Davis. I identify as an abolitionist, someone who seeks the liberation of all minoritized peoples. And I saw Angela Davis speak one time, and she was talking to a student who's like a biochemist student or something, and who asked the question, how am I abolitionist? I'm doing biochemistry. And she said, I'm sure biochemistry needs an abolitionist there, because everywhere we go, all of these systems are carceral. All of these systems are built by racial capitalism. So all of them need to be dissected and dismantled and reimagined, right? And so I truly believe that my work inside of what it means to be anti-oppressive, anti-racist, to be working towards liberation, is to be alongside queer and trans folks in particular. So most of my practice is with folks who are trans, non-binary, and or queer, and inside of polyamorous and ethical non-monogamy relationship structures. Those are the most, all of my clientele, yeah. And I want to take a time to note the fact that I said peer support and therapy, because the reason I do peer support inside of this practice as well is because I'm in Indianapolis, Indiana, and I'm one of the very, very few trans therapists that are in this area. I can think of less than a dozen actually statewide, and not that I know everyone, but we're pretty connected. And so there's just not availability of like trans folks being able to go and just see a trans therapist. Like, it's not a wide thing. It's not a common thing here. And also we're literally in community together because it's a small community and we're in Indiana, a very red state. So our survival literally depends on us knowing each other and being in community together and working together. So how can that look when you also need access to some kind of mental health support, and we're in community with each other in every direction we look, right? So what we do inside of peer support is we just enter into a very frank contract together where we talk about the fact that we're in community together and that this person needs support and they want to access that support with the trans person that we both know we're in community together. So what that might look like is maybe we serve on a committee together through the Pride organization. Should this person suffering not have access to a trans mental health professional because we happen to be working for our community in that way, I think that puts us in a weird ethical spot, right? And so peer support, drawing upon models from field of addiction, as well as like care circles inside of disability justice, we figure out how to contract our work in very frank and honest ways and figure out the boundaries and parameters of our relationships so that we can engage in that kind of support and remain in community together as well. And we don't have to choose between the two. And we continuously address those boundaries and parameters that are specific to our relationship. Specifically, what else? Okay, so what myopia looks like in real life, in practice, right? So I was thinking about this and I'm just thinking about like, what do I do client facing? And then what do I do not client facing? Because to be a committed anti-oppressive practitioner is a commitment, right? It's not a style. It's not even a modality. You know what I mean? It is a commitment to show up to your practice every single day in an anti-oppressive way, to go against the grain that are even ingrained inside of us often, to be able to dismantle the systems of oppression in the way that they've become ingrained in us, right? And so what that looks like for me client facing is informed consent and collaboration, informed consent and collaboration. And I know we use those words a lot in social and it often though feels like informed consent kind of becomes a step that we just like check off and like keep moving, right? And collaboration can almost become a metaphor instead of what we're actually doing here. And in anti-oppressive practice, informed consent has to be a continuous process, right? Like we're incessantly consenting to the work that we're doing together, and that the way that we're doing that work together is benefiting and is contributing to healing, right? And so that's like some constant check-in stuff and actual collaboration, right? The client sets the agenda, I don't set the agenda. And if they have nothing for that day, then, you know, we decide together what's good to dig into today. But I don't come in with my agenda and say, according to the modality that I use, here's what we do in every agenda, right? The client says that to me, I don't say that to them. And I'm not an expert, and I don't try to be an expert. I'm a listener and I'm a reflector. And I really, anytime like folks, because that power dynamic and that expectation really exists, like it just truly exists. And so unless we are intentionally trying to minimize that power dynamic that exists between therapist and client, even peer support specialist and client, then it's going to stay existing there, right? I literally say out loud, like, I'm not an expert of this. Like, I'm a human struggling with my struggles too. And here's what I see from my perspective, right? But I'm saying that like intentionally with clients. I had a client a couple weeks ago, just in a moment of exasperation, say, but Rand, you're supposed to have it all figured out. And I was like, can I pause you, please? Oh, and we have pause agreements that we have, so we can literally pause each other. I can pause a client, clients can pause me. I said, can I please engage a pause agreement? The project for me is not to have it all figured out. Our informed consent does not include Rand having it all figured out. Like, I am a human struggling under racial capitalism and transphobia and homophobia and misogyny inherent in racial capitalism. And I'm with you to support you and surviving this too, right? But the project here and the goal here is not Rand has it all figured out, so let's figure it out. That isn't what we're doing here. Authentic relationship, I think, is pivotal to the work that we do. In our anti-oppressive group consultation that I highly recommend folks engage in, a colleague a couple weeks ago said that they believe that anti-oppressive practice has to be a commitment to authentic relationship, which they really differentiated from like building rapport. And I appreciate, and I really wanted to just echo, as Jack Kopu said, that I really want to echo that and just say that here, that I think, yes, that when we're building authentic relationships with clients, that's going to look different than like how we're taught to build rapport in like our interviewing one-on-one classes, right? That we're showing up as ourselves, and we're minimizing that power dynamic intentionally. And I want to say what this also might look like for me specifically, because I'm a queer and trans person working with queer and trans people. I do a lot of self-referencing that I think inside of our, MSW programs, we usually would say that's inappropriate, right? And also trans folks come to see a trans therapist for reasons, right? And we have very specific like experiences that we might share. And so I would be remiss to not, reference something that I've gone through with hormones, right? If the client that I'm working with is struggling with something hormone-wise, and I just know something because I've been on this hormone for a while, why would I not bring that into the session saying, here's something I've experienced before, what about this, right? And that's not making it about me, because self-referencing should and still always center the client's needs. If we're just talking about ourselves for sake of talking about ourselves, that's not anti-oppressive practice, right? But that self-referencing might look a little different inside of anti-oppressive practice, because we're not acting like these things don't impact us too, right? I'm not acting like I'm not a person trying to survive transphobia in Indiana in this political moment. I'm not acting like that. I'm being authentic inside of who I am. So authentic relationship, systemic and oppressive systems are named, if that's not obvious yet. They're named very explicitly as sources of suffering, as valid sources of suffering, as valid sources of trauma, generationally, historically, and present day, that we hold in our bodies. So that is regarded as just true inside of the work that I do with folks, that we as queer and trans folks, I'll say specifically, inside of this political moment, are enduring a severe and massive attack, and that wears on our bodies. And so we talk about that, and we acknowledge that, and we talk about what it looks like to survive in this political moment by remaining our true selves, and remain our true selves in that commitment. Take a drink. Cultural humility and reflexivity have to be a part of anti-oppressive practice. Is absolutely part of my anti-oppressive practice, which includes assessing myself. So I am thinking about the ways in which my relationships to power and oppression are present in every session, and how they are in relationship to my clients' relationships to power and oppression, right? And like how that's impacting our dynamics in the moment. I'll speak candidly about a client that I have who is a Black woman who is queer also, but I'm not Black, I'm white, right? And now I look like a man mostly. And so I have to, right, reckon and wrestle with the fact that I am in a therapeutic relationship with someone who is Black while I'm a white man, right? And so what does that mean for the dynamics of our relationship, and how might that impact our work? And what should I do and not do as a white man therapist who's in relationship with a therapeutic relationship with this Black woman? How should I change my practice? Not if, how should I change the way I practice? Because of the historical and present day trauma and racism that simply exists is in the room by virtue of our relationships to power, right? So the way I practice with her is not the way I practice with a white trans person, right? And shouldn't be. That's the reflexivity. And that's on my own in preparation and post-reflection, but that's with the client out loud, right? Also, like we talk about those dynamics being at play. And that's also in consultation with community, in consultation with community, in consultation with community. So which takes me to my last point of what my anti-oppressive practice looks like, which is it has to be in community. I cannot hold myself accountable to racism. I cannot hold myself accountable to racism, right? That has to be in community. And I'm grateful for that community. And so what that looks like for me is engaging in our anti-oppressive group consultation, staffing with Charla, a lot, a lot. And I would say what it means to do anti-oppressive practice for me in community is also like being in community with the folks that I serve too. I don't just have clients, like I have folks that I'm in community with. And so I'm at events, I'm at Trans Day of Remembrance and Trans Day of Visibility events. I'm at Pride events. I sit on some committees in the community. People know that they can come to me for advice on like how to write a gender affirming care letter for trans folks. Like I'm in the community as well. And I think that is an important and pivotal part of my practice as an anti-oppressive practitioner. And that's it.
Lovely. Thank you so much. I guess it's me next. There we go. So I'll talk a little bit about kind of mirroring that to some extent of what how my practice has evolved, of what practicing in community looks like and how my practice is set up. Anti-oppressive practice. Okay. All the words. So for me, practicing in community is me supporting Black women. Descriptor of myself, I'm a Black woman with natural curly hair today. My hair changes often. Pulled back in the front, blonde on the ends. I'm wearing a green sweater with 2 necklaces sitting in my office where I do therapy a lot of the times. And for me, again, I'm working with Black women. I'm doing therapy with other Black folks. The reality is that Indianapolis is a big city. We're about to have All-Star Weekend here in Indianapolis. We have major sports teams. This is a city of conferences and events, and we are not like a small town. But also, if you get to Black people in Indianapolis, well, that is a small community. And when I am a Black therapist who is providing services to Black folks in Indianapolis, that means that I am almost always going to be in community with my clients. That doesn't necessarily mean that I'm BFFs with my clients, but it does mean that I have friends whose cousins come to Connected in Community for therapy. The chances of me not having those type of overlapping relationships are pretty slim if I'm going to actually provide services to my community. Just as a point of reflection and like my teacher brain, just take a moment and reflect on the reality that a lot of times folks are already set up to practice therapy and to do this work from a place where they are helping those people who are totally disconnected from them. I think one of the reasons that it is important for Rand and I to practice in community and to find ways to do that is because we are less likely to cause harm when we are actually existing in communities with our clients. So although we will talk about getting creative with our ways of practicing and exploring what practice could look like, we are not going to cause harm in the spaces where we also have to get our resources and our needs met. We are in community with our clients. And so it changes and affects the ways that we service them and how we show up for them because they are our community to some extent. So I get the privilege of working with majority Black women when I am seeing clients. And that was really helpful for me when I was starting out and building this practice. I was able to, use my own circle of influence to grow a business. I am an anti-oppressive practitioner and I love anti-oppressive practice. I also am learning and evolving to also become an anti-oppressive business owner. And so some of my reflections are going to speak a little bit more to the business side of what it's taken to create this like in-community business. And so we have had to set up some boundaries as a business to help make clear how we will engage with our clients, what that looks like. I talk to them in our paperwork when they sign on about what our social media looks like, because we do use social media. We engage in social media. We are at local community events. Our clients are going to see us out and about. And so we just talk on the front end with all of our clients about what that looks like and how they can engage with us in the community, making sure that they understand how, HIPAA and other things like that, how that's going to be impacted by them seeing us in the community and how they choose to respond to us. But some of that is also getting rid of the stigmas and ideas that we have around mental health. I don't think that very many people are having these kind of conversations at dental conferences or other medical providers. People see their dentist at the grocery store and speak, and it's no big deal, but somehow there's this taboo-ness about therapy. And so some of it is just dismantling those ideas that say that we need to be separate from our clients and that we can't be in community. We are medical providers like any other medical provider, and we can practice in community. So that's what that looks like for me. Some of the challenges that have come up from trying to create a business that looks a little bit different than how some other folks might be used to seeing business. One of the things that I've noticed for myself is that I come to this work in the ways that feel authentic and true for me and how I want to operate and the kind of place that I want to work in. So it's not always so much as trying to be confrontational to the norms of how business has existed before, but trying to find anti-oppressive, inclusive ways to create business and to have business without thinking about or leaning into how it's always been done before, trying to be creative about what that could look like. The reality is, and I know, is that this is business, this is capitalism. This is not some inclusive kumbaya thing. We still have to make money and we still have to have capital. And this is something that Rand and I talk about in our supervision together and grieve together and just talk about the complexities of the reality that we cannot have any true equity within the mental health system as it is structured. And so we have to navigate those realities and figure it out and find solutions. And I do that just as I would for clinical practice. I have to use community and supervision to talk to other people who are also building businesses that are trying to find ways to do it in inclusive ways. I have to use my imagination and just simply come up with new ways of doing things, but it is a constant exploration and something I have to put energy and effort behind, because if I don't, then the normal will return and it will just be the normal, and that will not be necessarily the most inclusive or least harmful way of going about having a business and doing practice. When and how has my practice evolved? So I was trained as a clinician when I first graduated in school, like anyone else was. I worked in community mental health. I did home-based care. I also worked as a school social worker. And in all of those spaces, I learned various modalities, but I wasn't always challenging the status quo or practicing differently. Some of that has had to come from my own personal evolution, of figuring out what is it that I believe in and who is it that I want to be and how I want to show up in this world. I will say that I think I always had a questioning in my mind about why some of the policies at various places I worked were the policies. I recognized sometimes that the ways that we were practicing wasn't actually making change or impact in the ways that I wished that we were. And so when again, I came to Connect in the Community and I was starting this practice, I've been the whole time trying to figure out, how was I trained to do this part of the work and what actually makes sense? What do I have to do? How much of those practices that I was taught do I need to adopt and bring into this business? So for small example would be, traditionally, practices are run with electronic medical systems. People purchase Simple Practice, Therapy Notes, one of these kind of big programs. And there's just this very medical way of people doing an intake packet and all of this onboarding in order to get access to services. And I just knew that in working with my community, that was going to be a slowdown for people being able to just make an appointment. And so I put a lot of energy and effort in the structure of my business to really think about, how can I make it a HIPAA compliant pathway for people to be able to sit at home on their phone, scroll past something that says something about mental health, or just get in an argument with someone, or for some reason say, you know, at this moment, I want to find a therapist. How can I make it that when they go to our website, they can immediately schedule a consultation? They can immediately move through the process. How can I eliminate any barriers to them accessing the services and make that as smooth as possible? And so I have put the energy and effort of my business into that part of creating an organization that is actually going to meet people where they are and meet their needs and serve them in a way that makes sense for how they live their lives. Without getting too much in the weeds, the system that we use for scheduling, while we have electronic medical records internally that we can use to hold people's documentation and paperwork and do treatment planning and all of those things, really the client facing in is a system not too unlike what they might use for accessing a barbershop or other appointments that people might be familiar with, because the clients that we serve, especially when we get to an age demographics, our clients are used to things that they can access on their phones really easily without a lot of hurdles to, just getting the services and getting their needs met. We don't need to have such a heavy paperwork, medically driven pathway of care. And we can have something different, but somebody has to create those new and different ways of practicing. So it's been a lot of challenges figuring that out, things not working, trying out different things. I've been very grateful that the clients that we've had have been really flexible as we've made some of those changes, because they have had to see some of those changes happen. But this is part of figuring it out and trying to find a way to do therapy in a way that's more inclusive, in a way that actually meets the community's needs, in a way that speaks to the culture of the clients that we want to serve. We try to be really intentional about that. I was talking about the evolution of my practice. I'm sorry, I got distracted. The evolution of my practice first looked like everybody else was trained, learning modalities, doing those things. As I've come to explore who I want to be and how I want to be a therapist, how I want to show up in this work, I want to make sure that I have become more and more aware that the things that I struggle with personally are also a reflection of the ways that the world is operating around me. And so as I have come to less silo my own life, where mental health is maybe one thing, or work is one area of your life, and then your social life is another area of life, but come to see it all together, and as all of these things impacting and reflecting with one another, it also has been an evolution in my practice. The more I come to trust my own body, my own knowing, my own understanding, it has evolved my practice, and it looks different, but it's something that is constantly changing, and I'm working with Rand to explore and figure out what that looks like. What does anti-oppressive practice look like to me? Anti-oppressive practice with me means that I am operating from a version of truth that says that white supremacy is a lie, that gender is a made up something, that says that all people are worthy. It is operating from an abolitionist point of view. That is my north, my truth for me. And I am open and honest with my clients about the fact that that is my truth. And since that is my truth, it is going to influence everything that I do. And I'm just open and honest about that reality. So if I am working with someone and they are exploring dynamics in their relationship, well, I'm going to operate, if I'm working with a cis-het couple and they are struggling with dynamics in their relationship, I am going to be operating from a place where patriarchy is real. And since I'm operating from that place, I am going to talk to this couple about the ways that gender norms or ideas about gender and gender norms might be impacting their relationship, and encouraging them to and supporting them through maybe challenging some of those norms so that they can find something that works for the two of them in their relationship. Those are things that I'm going to be bringing to the practice, because that's what's truth for me. To me, that's evidence-based. To me, that's in line with what all of the research we have says about the world around us. And I don't want to work with someone and pretend like that's not also in the room. To me, that gives too much power to the oppressive structure. And so I want to name it and call it into confrontation and as a part of therapy work, and do that with my clients. And so that's what anti-oppressive practice looks like for me. If I can talk to you guys really quickly about, again, the business side of this. The business side of what I am talking about is that Connecting in Community is doing well on a business side. When I told you guys about George Floyd, and when I first started seeing a couple of clients on the side, Connected in Community was literally born in July 2020. That's not that long ago. So we are less than 4 years old, and we were me seeing clients on the side while working full time. In that time, since then, we are now a team of 6 clinicians, like starting up, and we've got some other projects, which I'll tell you about here shortly, but we are making an impact. This last year, we saw 166 clients as a practice. We provide over 800 therapy sessions. We have Oreos in our front office, so we went through 240 Oreos, 132 tea bags. We offer tea in the front. 32 boxes of tissue. We also had 38 speaking engagements, and we also sponsored 4 community events. So we are making an impact and doing things in Indianapolis. And I think that sometimes people think, well, practice needs to look a certain way to make money or for it to be a good business. But the reality is, as Rand mentioned, there's not a whole lot of trans therapists who work with trans folks. There's not a whole lot of Black therapists who work with Black folks. There are not in Indiana, for sure. There are not a lot of therapy practices that are openly inclusive to people who are not in a monogamous relationship. There are not a lot of therapy practices that are comfortable talking about the ways that racism is impacting your experience on your job, or how being fat is impacting your dating life. There are not a lot of therapy practices that are ready, willing, and open to have those conversations and have those conversations directly. And that's where we have found a niche, and it is definitely working for us as a business model to be able to speak directly to the people who are otherwise not served by the larger community in the ways that therapy has always been done. I'm going to tell you a little bit about our therapy lab, which is a newer project. I'm slowing myself down as I talk about our therapy lab, because it is a new project. I mean, like January 8th, we really kicked this project off. So it is something very new to us, but it is a project that Connects in the Community is kind of sponsoring and supporting, but it's a nonprofit project to bring in students who are learning how to practice from an anti-oppressive approach. We are teaching students, Rand and I, how to practice using all of the things that we're discussing, how to bring in social inequality and conversations around social justice and apply those to the therapy that you're receiving. And so we have 4 students right now who are providing therapy at a reduced rate. They provide $40 sessions for folks to come and get that therapy services. That way the students are getting the experience. Rand and I can coach them. And then they also do weekly group consult. They do several meetings, but one of their meetings is they meet together as a cohort of students, And then either myself, Rand, or somebody else on our team, we also have outside folks who come in and talk to them about modalities, about engaging with various populations, about understanding themselves as a clinician. And they're getting workshops while they also get this experience of doing therapy. Yes, they get paid for all of these things because we're not exploiting people's labor and just taking the money. So this is a paid practicum opportunity for the students in our area to just learn how to practice in this style. Our therapy lab, again, this also allows like Rand and I to, one of the barriers is that folks will be like, well, I can't afford therapy. I can't get access to mental health services. And so this is a way that we can support students who can provide those low-cost services, so that we're making sure that we're increasing access to low-cost inclusive services in the community, but it also, we can do it in a way that is actually sustainable for all of us. And so the students are able to provide that while they're getting the coaching and supporting from us on how to, tackle those cases. And then lastly, we have education. So as much as we are training the students who are in this program, and we currently have one resident person also. So that's a recent grad who is still earning hours before they can pursue their clinical license. We are providing these trainings for our students and resident. We are also providing some of this stuff to the community. So whether that is, somebody hires us to come out and do a training, we are providing a training online, or our biweekly consultation group that we host on anti-oppressive practice. Rand and I together. Rand, do you want to speak any more to the continuing education? Because that's really your project.
Yeah, so like I mentioned in what I do at Connected is peer support therapy and education. And really the continuing education, I think like Charla was saying, the North Star is liberation, and is how are we making this world a better place? And so you'll have, therapists who've been in it for a long time, and then they get these new grads in here who are talking about anti-racist practice and anti-oppressive practice. And it's like, what is that? So we want to be able to provide just a really super non-judgmental place to come and learn about that. And then also the kinds of like, how do we work with trans people? How do we support trans people? How do we write gender affirming letters for folks who are trying to get gender affirming care? Because therapists are still the gatekeeper to that care. It's the only medical care that requires a letter from a therapist in order to access. And so we still stand in that gatekeeper role. And the more of us can do it, that can and should be writing those letters and writing them for free, then the more care for trans people, right? And then eventually abolish the necessity to have a letter for such care, because it's nothing but oppressive. That kind of education they can get from, we have workshops that they can come and either bring us into their group, and or if we get enough interest to just have a training, then we'll just put it on. Another one that is in the process of being built right now is working with folks who are engaging with polyamorous and or ethical non-monogamous structures. That's a good deal of our clientele. I don't know the percentage, but we staff those cases pretty frequently, and are doing that work with prevalence. And so I'm pretty sure all my clients are actually in a non-monogamous structure of some kind. And so what does that practice need to look like and feel like? How might that be different? How do you show up to that work in anti-oppressive ways? Those things are what's currently available. But our offerings are truly, because this is the new kid on the block, our offerings are truly dependent upon community needs. So there's something else we're talking about here, and enough of you are like, hey, can you talk about that more, please, with this group of people? This is the channel for that.
Thank you for saying that. Like, yes, please tell us, y'all, what you need, because one of the things that, without going too far off script, one of the things that I'm very grateful to have Rand for is that I was exploring these things. I would have these conversations, and Rand was one of the only people I knew in real life who was also trying to practice in a way that was being intentionally anti-oppressive. And so I've had, the great benefit of having Rand in my life, and we can talk about things and have ideas, but we really want to build that community of other clinicians who are also trying to explore what this practice looks like, because neither of us see ourselves as so much of an expert that we should be the ones telling everybody else what anti-oppressive practice should look like. We just are people wanting to figure that out and wanting to explore it and create space for other people to learn. You want to talk about reflexivity? You want me to?
So we've talked about reflexivity a little bit. So the idea that, going beyond self-reflection, even critical self-reflection, reflexivity asks us as practitioners to really dig into our relationships to oppression and power and how they're impacting all of our behavior day to day, and also how they're in relationship with our clients and our clients' relationships to oppression and power. So taking that lens, we just wanted to open up space to practice that together. So to ask ourselves, what is our current strategy for reflecting on our own social and emotional needs, right? Because we are in this work with our clients. If it's a collaboration, that means we are present and the systems that we come from and we're attached to are also present. So how are we being attuned and in tune with ourselves, which is pivotal inside of this work? How are you challenging false narratives about gender, race, sexuality, and disability, et cetera, with your client care practices? What are you doing? What are you not doing? Are there things your clients do that bother you, get on your nerves? What are they bringing up inside you? That's important. That should be listened to, right? And we're not doing anti-oppressive practice if we're just smushing that and being grateful that that session is over and moving on, right? Like that's something we need to pause with and really dig into together. But do we have spaces where we're actually asking those questions, right? And being for real with our colleagues about what that is, right? Because it could be racism. It could be misogyny, right? It could be my own internalized oppression that I haven't uprooted enough yet. And this client is bringing that up in me, right? It also could be they remind you of your mom and you just got to talk to somebody about that, but those things are important and should be listened to. Are you practicing an environment where your clients are safe with you there? Are you socially and emotionally safe with them? Some certainly beginning questions. And we want to open that up for folks to express with us, right?
Absolutely.
Yeah.
They can use the Q&A to do that if they had any reflections using the questions that we have here. I actually had a supervision this past week, Rand, where I was talking to someone and they got to a place where they recognized that the way the client was expressing themselves was really reminding themselves of themselves at a different time period. And so that was limiting their ability to not feel annoyed, because they're actually annoyed with themselves that they didn't have it together. And so just reminding everyone that this is the work, is figuring out what's showing up for you, how you feel, and what you look like in the room, because you are in the room. I think one of the things that we learn in school all the time is that there's this false idea of objectivity and you're just there to provide information and just be an object in the room. But like, that's not true. There's no way that you aren't leaving an imprint on someone's experience, their life. And so just being honest and conscientious about the ways that we show up in that. I think it's just a good practice. So if you have any reflections, you can put it in the Q&A there. Just a second, we're going to do questions anyway. I know there's some other questions that people had, and we can answer those here in just a second also. But before you do, I just wanted to tell everybody about our group consultation before we go to some of these questions and reflections in the chat. We have an anti-oppressive group consultation that Rand and I lead every other Wednesday. We just met this past week, so our next one isn't until February 14th. But on February 14th, we will have at 10 a.m. Eastern time, we will meet to discuss some of these things and help folks figure out what practice looks like for them. If the rate is an issue, send us an email. We have avenues to go around that, but this is a part of the services that we do with the students, so that it allows us to be able to pay the students and to do all of that stuff by having these kind of paid events. Yeah. You want to go? I'm going to go to the questions in the chat, Rand. Okay. Unless you saw something that you wanted to answer right away.
This first one, Wesley. I can answer Wesley's question.
Okay.
So Wesley said, Rand, what are your thoughts about stealth trans individuals still providing allyship to trans individuals in practice without coming out to them? Not stealth for safety concerns, but personal preference. Do you feel they can still provide a similar community that can be helpful to trans individuals? So just real quick, stealth means inside the trans community, folks who are trans, but they pass as man or woman, which is the binary that we're still all are forced to ascribe to, unless you do something different on purpose. So stealth means like someone can quote unquote pass, and there's a lot of contention around the word pass too, as being inside the binary. So my thoughts on that are, can a stealth trans individual co-create an anti-oppressive and supportive environment with their trans clients? Yes, absolutely. It is my belief that it doesn't matter your relationship to power and oppression. If you show up and are committed to being an anti-oppressive practitioner, then we all have the capacity to unlearn and uproot those things inside of us in order to co-create that space. I think what makes the space different with folks who are stealth trans, working with trans folks, is that that's a different power analysis, right? If folks prefer to continue to be considered a man, considered a woman, and transness is not part of their identity and or not part of their shared identity, then trans folks won't know that, right? So the practitioner then, the stealth trans practitioner then would have to take that into account inside of the power analysis, because the assumption is that you're cis, right? And so if that's the assumption that folks want to be with, okay, but that's going to change just the way that we analyze power in the room, right? Because you may or may not be self-referencing transness, or probably wouldn't be self-referencing transness, so trans folks wouldn't necessarily know that that person is trans. So can that a safe and supportive environment be co-created? For sure, for sure, for sure. It's just going to look different in practice because that power analysis is different.
Thanks. I'm gonna go with Jay. Well, before I answer Jay's question, several people asked about the consultation group. Yes, this is the one we have. Yes, it costs, but send us an email. We're not in this to like make money. We're just trying to also, like I said, provide other services to other folks. So send us an email, we can get you in. Jay asked about Jay said, I'm noticing gender, race, sexuality, and disability are getting more visibility in the industry lately, but class is still something few practitioners talk about. I'm curious to know if how you bring class oppression into the conversation. So for me, again, where I'm often practicing in community with other Black folks, I would never be talking about class without also talking about racism, or without also talking about patriarchy. Those things are all like directly intertwined. So where I say like I'm talking about race, that also includes talking about class, because those things are so interconnected. So so yes, we do talk about class, but we often talk about it in the context of other systems at play. I can imagine that if I were a white clinician seeing mostly white folks, that there would be times when we might talk about class without making a direct link, at least on the front end, because it wouldn't be a natural connection for those clients maybe to see the fact that that the way that class exists in our country is directly related to racism. But that is something that, again, the clients that I'm serving as other Black folks, they have a knowing and an understanding of the ways that race and class are directly related, so that it almost they are directly tied together already. We don't have to tease it out as much just because it's a known fact and relationship. Myranda, is that different for you working as a white person working with white folks?
So I think like as a white anti-oppressive practitioner, it becomes part of my responsibility to name racial capitalism as our material reality. That if white folks that am working with, even trans white folks I'm working with, I say racial capitalism. I don't just say capitalism. So I'm always making that link because I think it's important for white people to always be making that link. Secondly, though, I think class is just inherent in our work because I work with mostly queer and trans people who are not making money. making a lot of money. So I mean, class oppression just is part of our work because of the nature of, suffering under racial capitalism. I don't really need to bring it in much, my clients do.
Stephanie asked, do you feel that a therapist having to sign off for individual or bariatric surgery is a similar category? I have thoughts. We didn't prepare this. You want to talk about it? I'll tell you what I think.
I'm gonna go first, is what you're saying? I
You
can.
want to, or you want me to?
I can. That's fine. I just want to thank Stephanie. I didn't know that. And so like I'm thinking about that now and how fat phobic that is and how that's probably super interconnected. But I'm grateful to know that because that's something I want to bring into, the talks that I have about this. That's my feedback.
Okay. Yeah, I think that it's not my area of expertise, but I think there's a lot to. I would really be interested to hear from clinicians who work in the bariatric world who are also actively trying to wrestle with fat phobia and the ways that it shows up, how they are balancing addiction and also health and beauty and the way that all of these things are interconnected in our society. Because it just seems to me like a difficult thing. I don't know. I don't feel like I have the right answer or that I have the answers there, but I can recognize there are things to unpack in that world. It's just not my area of expertise. Kylie asked, is the group consultation just for therapists or school social worker? No, you can come if you're not a clinician.
And we actually we have a school social worker who comes pretty regularly, so you wouldn't be alone.
Yeah. Resources that we would recommend for teens that live outside of Indiana?
I'm not sure, like in a general way, if we're talking about, queer and trans teenagers, national organizations I look to are Gender Spectrum. They have a whole bunch of resources around how for supportive families, supportive schools, like they kind of just touch all the systems that teens are in, queer and trans teens are in, and helps to have actual support, but then also like some policy and infrastructure support. So Gender Spectrum is who, if we're talking about queer and trans folks, queer and trans teenagers, which is my line of work, that's what I would say.
If I could use that as a springboard to talk about what I didn't bring up earlier, we also use Connected in Community as a tool for like larger policy impact. So when we said we sponsor events like Pride locally, we sponsor events like other like Black community focused events. We sponsored, my measurement for if we can sponsor an event is, does this event bring joy, therapeutic joy to the clients that we actually serve? Because that's also a part of their care, is that for them to have spaces and opportunities to experience joy. And so our investment is in creating those in the community. So there's that on the sponsorship side. And then the other way that we use the business to make an impact is that we are also partnered with our local ACLU. And I mention that because, using the business as a tool to write letters, write testimonies about how certain policies would impact our clients, our work, and our ability to do business. It becomes another tool in our toolbox to advocate for change locally, is to use the business organization. Rand and I could be individual therapists to advocate, but unfortunately, in the reality of the culture that we exist in, it means something more for a business to say that the way that this new policy is going to somehow negatively impact our ability to do business or conduct business, or is going to create a risk for our business. And so we name that specifically around queer, trans policies and abortion rights. Those are the two areas of focus that our practice has invested in doing that advocacy work at that level. Actually, one of our social work students just this past week spent time at the State House doing some learning to do some advocacy. So we are still also doing that part. I think sometimes folks, especially social workers, are like, it's macro or it's clinical work and they're totally separate and they don't overlap. But clearly, that's not how we see this. Because I'm actually a macro social worker. I didn't do the clinical track. Okay. Somebody asked if we do insurance. This is a good question. I'm glad you asked. Here we go. We do not. We do not accept insurance. This is something that Rand and I have had multiple conversations about. I am not a fan of it. Would I ever be open to us accepting insurance? Possibly, maybe for some people, but it's not something that I'm interested in doing. It's not how I would like to practice. And so I can name that. I can explain why it is not for me. Insurance requires that I provide a diagnosis, and it sets my whole practice up in a paradigm that is out of line with what I believe is true. So to me, for example, you have a client who has a fear of the police. It's a Black male who has a fear of the police. The way that our medical model system is set up, I have to diagnose him as if there's something wrong with him when he is having a natural and normal response to the reality of society. And so I don't like putting the diagnosis on the client versus helping the client to be able to wrestle with the realities of their world. So I am not a fan of insurance for that reason. I also want to use this question as an opportunity to express my frustration with the way that we talk about therapy. And a lot of times we talk about it in the context of anti-oppressive work, and we'll talk about it as if people who are poor, Black and brown people, they have the most need, or they need therapy most, or mental health is mostly an issue in those spaces. And I really want to challenge people there. To explore what you're actually saying. I believe that to openly and actively cause harm to other humans around you is not operating from a space of wellness. So, do with that what you will. So I guess my overall assumption is assertion is white folks need help too. White folks need a lot of help. White folks need a lot of help in the context of anti-oppressive work to uncover why they are so mad, or why they are hateful, or why they might want to push for policies, big policies like at a federal level, or even small policy down to how they are inflicting harm in their kids' school because they want to make sure that this kid doesn't get something extra. That's not coming from a place of wellness. And I personally would like to see a lot more white therapists, white clinicians working with white people to explore what it is that they're struggling with that pushes them to do the Karen thing at the grocery store. Because that's not coming from a place of happy, well, whole humanness. That's coming from a lot of pain. And that needs therapy, and that needs help. And the reality is, like it or love it, some of those folks are never going to go to community mental health. So who's going to be there to provide them the care that they need? And so sometimes maybe we need to be packaging therapy a little bit differently to speak to the people who actually need the services so they could stop harming. It's kind of I'm sorry, I'm doing a little soapbox thing, but it's similarly in domestic violence. We don't need more services for women to address domestic violence. We need services for men to help them figure out their stuff. So could there be more men creating therapy that speaks to the needs of men so that they could help and work with them on being decent human beings? Yes, that could be the work. I think I wish there was more of us engaged in that work versus the positionality of how we have been enculturated to see mental health and services, which is insurance-based. People in poverty have the most need. Very community mental health, follow the script way of servicing them. A very poverty-driven way of even introducing mental health services. That's my 2 cents. Any reflections?
Not really, no. I really appreciate how you did that.
Sorry. Recommending all clinicians sign off gender affirming surgery, no matter their level of clinical experience and access. Did you see that question from Christine?
Yeah, I'm right. I was gonna say I can take that if you want. Appreciate you, Christine. And I'm thinking about this self-reflectively and inviting us to collectively reflect, because I'm wondering what those unintended consequences might be, right? What the harms inside of encouraging folks to write letters for trans folks for gender affirming care. Yeah, I'm wondering about the unintended consequences of that. And I also want to be clear that I am recommending that if you have a license and you're trying to do anti-oppressive work in this way, that you do understand the power that you have in helping trans people access life-saving care, and that be something that you do, that's just part of your practice, and that folks do it for free, because folks are still charging trans people for that, and I find that to be very oppressive. So I am wondering about the unintended consequences of encouraging licensed therapists to stand in their power and help folks getting access to care. And also, I am saying that folks, I'm not saying folks do this without training or supervision. We have a training for that thing in particular, and I am available pretty much on an ongoing basis for folks in the community, other therapists, and folks here. When folks have questions about what should I do about this letter, or this trans person came to me and I'm struggling with this, that's what the AOP group consultation and being in consultation with folks who see trans people regularly and trans people, right? That even WPATH, so there is a standards of care, by the way, that trans people also have mixed reviews on, because it's an association, it's a standard of care that's put out by folks who are mostly cisgender for trans people, right? Standards of Care 8 just came out this past year. So the training that we offer at Connected takes folks through how to do that assessment and write that letter and as anti-oppressively as possible. But it is coming at it from a harm reduction model, because we have to, right? Because we're put in this place as licensed clinicians to have to sign off on this care. And so if we are put in that place, how can we minimize that as much as possible for trans people, make that as easiest, cheapest, free as possible for trans people, because it shouldn't be a step in the process at all, period. And internationally, that's regarded as such. Internationally, being trans is not considered a mental illness. It is not even a diagnosis. The ICD, which is what we use, right? That we've just in the DSM-4 had to align, or the DSM-5, I think, aligned it with the ICD codes. But the ICD codes, which surpass the DSM codes, right, don't identify transness as being a mental illness. So I think there's a lot there for us to wrestle with as folks who are still just in this moment. And trans people have barriers to care everywhere we look. We're under massive political attack of politicians and entire groups of people trying to rip away our access to any healthcare at all. So my sincere urging for folks here is to reflect on how you can help trans people get access to care. So if that is getting training, if that is getting supervision, so you can feel equipped to write these letters, please do that. Hope that answers your question.
Thank you. Can I chime in on my little 2 cents as somebody not in community, but I write the letters, because I want to highlight for those folks who might be more macro and not clinical. If you're licensed, this is somewhere where you can help. I think sometimes people who are more in the macro side, don't recognize that they still are a gatekeeper and have access to tools in their degree where they could also provide this service to the community. So just wanted to add that 2 cents. Someone had mentioned that we need to read the whole question. So I'm going to read Bethany's response. And Bethany shared a thought that she is a Black cishet woman therapist in Madison, and she primarily has a caseload of white men, cishet men. And she struggles to find things that don't bother her in her interactions in session. But she tries to openly name those dynamics in the room with them. And that she's feeling and name any feelings that she might be feeling, even though she doesn't have the support of her organization. Just as a Black person, I want to name the fact that the way that Rand and I get to practice, there is a bit of privilege in being able to practice in community. I am very, very, very grateful that to my own community that it has supported me in a way that has allowed me to build a business providing care to my community. I would not be able to do that without the support of my community. So I'm very grateful to have the privilege and opportunity to be able to serve in this way. Jumping around a little bit, but someone asked Judith asked, how do people pay for therapy if they can't use insurance? So to answer that a couple of ways. One, we have had partnerships with other organizations that provide financial aid for clients who need to access services. So there's money out there that exists from other organizations, and sometimes they will cover the cost of somebody coming to therapy and getting the services that they need. And we will work with those organizations if that's what someone needs. But again, I want us to push ourselves to challenge how we think about, can people pay for therapy and can people pay for services? Again, we are often operating from a place of believing that, one, this is something, we're asking this question. This question is often asked from a place of like, how are poor people going to get it? Or what about poor people? And I definitely appreciate that. And there's something to be reflective about there. But we have community mental health services. Most of us live in somewhere where community health exists. So there are services for people who can't afford things. One of the gaps, and this is a social thing, it's a social construct, yes, but people who make enough money are not accessing community mental health care. They're not they don't want to go to the free clinic to get mental health care. They want to pay for their services. Yep, I know, sounds crazy, but we all go to the grocery store versus going to the food pantry. Like everyone doesn't want to get the free. Some people, you gotta charge them so that they see the worth in it, and then that's how they're going to access the services. And so I would just challenge folks to expand their way of thinking about money and access and who needs access, especially when we get to the part where when we're working with folks in community mental health settings, often like that's triage work. That's a different, that's also there's different needs. Oftentimes we just are working with folks who are trying to navigate the consequences of poverty. And that is very like justified, good, necessary work that has to happen. And there's also work to support people who are causing the harm so that some folks are existing in poverty. There are people who have access to the resources that could be expanding access to others, and we can help and support them in doing that and learning how to explore what that would look like. Am I okay? I'm looking at you for feedback. You're the only face I see.
Yeah. Can I, is it okay if I add something?
Please.
And I'll say, like, my clients, not all of them are sliding scale, but some are. And I have clients come to see a trans therapist because they want a trans therapist. And so like, my clients are not rich. We're trans in Indiana, and that, yeah, that's part of surviving racial capitalism for us too. And it is a matter though of like folks are just prioritizing this because of their need and desire. And I do think that there is something to be said of trusting community to be community, that it can be hard for us to get out of the way the literal boxes that racial capitalism holds us in, you know what I mean? Of like the ways in which we can make money, survive, et cetera, et cetera. And I think when we dare to do something different, that community shows up for that.
Yeah, thank you for saying that, because people don't want us to be poor. We are operating in community. They want us to receive what we need to be able to sustain ourselves. Yeah. Aaron asked, if we could talk a little bit about how we teach students to be part of their community as a practitioner. She feels like she's still learning as a clinician and a parent. Do you want to take that on?
Sure. Well, I'll say like the teaching is in the practicing together, honestly, is at least the way Charla and I tend to operate. And so like our AOP group consultation, some students are in there and we're being authentic inside of that, right? Like we're practicing it together, like Charla said earlier. And I totally echo for myself too. I'm not an expert at anti-oppressive practice. I don't think those words should maybe go together because it's really about showing up to reflexivity every day, right? It's not about attaining or achieving anything. And so I think even the teaching, and as I teach students, that's my full-time job, it is in the modeling and practicing together. So the community we build in the classroom is also a reflexive one. So I teach them about reflexivity in a very like didactic way, sure, but then that becomes a part of the cultural norms of the space, and we begin to practice it together in real time. That's my answer to that.
Sorry. No, I don't think I have anything to add. Yeah, that is something that we work with the students on too, of just like getting them to, again, practice that reflexivity and like, it's a muscle. It's like a practice, something you become more smooth with over time. And so we hold space for them to explore that. Specifically, Aaron talked about being a clinician and a parent. And, you know, it's something that I'm passionate about, is also taking this stuff out of the box of your work and really, again, like bringing it to all areas of your life. You know, many of us here at Connected to Community have experiences where like our children are in community with the clients and things like that. And so like we bring our parenting into part of the relationship. Like we are a whole person as a part of our therapy practice. We are not just like a piece of ourselves that's doing the therapy. It is our whole person coming alongside the client in doing the work. I try to be intentional about that. Sarah asked, how do you approach providing services to individuals in need when there are wait lists or a timeline that doesn't match the need? So I don't know if this answers your question directly, but one of the things that we wrestle with, because a lot of this is like grief work, wrestling, being in community and having conversations like Rand and I, or they extended part of our practice, other folks. And grieving and feeling the heaviness of the fact that we can't be everything for everybody. We try to serve and show up and provide the services to those that we can in the best ways that we can. But like, we're not necessarily, we know that there's a wait list all over the city. There's so much need for access to mental health care. We are trying to do our best. As a business owner, I can tell you right now, I am trying really hard to even slow us down and not expand and do as much as we could, but it would max us out and what might impact the level of care and the kind of care that we can provide to those that we are already responsible for supporting. So I'm trying to do my best to constantly balance what our capacity is and remind myself that we don't need to save the world. We just need to be able to support and care for those folks that we can support and care for. Anything, Rand, any other, I think that's all the questions that we have. We got lots of other feedback and we're very grateful for that. Thank you. Rand, any other last thoughts that you want to share before we wrap up?
I'm just really grateful for the space. I'm really grateful for the number of people who are showing up to being interested in this work, not just this work connected in community, but this work as an anti-oppressive practice, because that's really, that's what we need, you know, not me and Charla, but like all of us to be committed to this work. So I'm just really heartened by that. I'm really appreciate being able to be part of the space.
I'll echo what you're saying. I appreciate all of you guys for just even being curious and reflecting. If this is something that you're already engaged in, I hope that we offer you just a reminder that you're not alone in trying to figure out how can you marry, you know, the truth with your clinical practice. We hope that we can be a resource and support to folks who are trying to figure out how to navigate that. But also, you know, open to your feedback if you feel like there are things that we're missing or other ideas and suggestions that you have. We are trying to figure this out and explore what could this look like if it was not oppressive and not just going along with the status quo. So thank you all so much for exploring that with us, and please reach out, let us know if you have any questions.
Well, thank you so very much. This was really, really interesting, and I really appreciate it a lot. And I know that the audience has. A question that a couple of people had asked about distance. I mean, in Indiana, do you have anything for people not in Indiana? Either do you have things that might be virtual connections, or any suggestions for that?
So I would encourage you to just connect with us. You feel free to send us like messages. Yeah, we're all over the place as far as virtual, like when Rand teaches the classes on letter writing and those kind of things, those are all happening virtually. When we have the group consultation, that's happening virtually. You know, we plan to have more courses that we're going to be offering virtually this year. So, you know, go ahead and check us out at ourtherapylab.org. And you can see the courses and things that we have. You can also find us on connectedandcommunity.org. That's the practice. They're separate sites, but they link to each other. So if you can find us at either place and connect with us there.
Oh, great, because I think that's an important thing, that that's a real advantage of being able to connect with people that are in very isolated areas where they might be facing exact same difficulties with community, to be able to connect up with you. Appreciate that very, very much. And remind people that this will be, the recording will be put on our website so that you'll be able to catch all this for today. So as we're closing out for our session right now, I want to, of course, many thanks to our presenters for sharing their time and expertise and valuable information with all of us today. And thank you to everyone in attendance for being a part of this event and your commitment and efforts to confront racial injustice and oppression. So please watch for an email with a link to complete an evaluation for today's presentation, and watch for a separate email regarding CEUs for those of you that have requested them when you registered. Also remember that the keynote speakers and most all of the breakout sessions from last week and this week will be posted as videos on our conference website. Last week's sessions are already posted and you have a chance to go and look at them. And next today, to wrap up our conference at 2 o'clock Central Time, to hear our closing speaker, Kelly Hayeswill. She will discuss how much discomfort is the whole world worth. Kelly will close the conference sharing ideas about organizing, how it can change the world and us. She'll be in conversation with local social workers, and together they'll help us think about embracing both the perils and promises that of moving forward together towards justice. So right now we'll have a brief break. You will sign out from this session, and the link for the 2 o'clock session was sent to you in your email that you had that came about today's conference, as well as it was posted in our chat a couple different times. I know that Tracy had posted it there. So I will look forward to seeing you all soon, and thank you very much again for joining us today.